mentioned the two approaches, the bottom-up method and the top-down method. So in the bottom-up, what they do, they start with an ultrasound, and then they do a VCUG, and so in this way they try to identify both upper and lower urinary tract abnormality, which includes VUR, bladder bowel dysfunction, and bladder abnormalities such as paraurethral diverticulum. In the top-down approach, what happened that they start with the DMSA, and on DMSA you can see that the area that has they have the primary parts, they appear photopenic on, and the kidney also seems to be enlarged. So one thing to remember is that in approximately 50% of the cases with febrile UTI will have a positive DMSA scan. So, and out of these 50% who have positive DMSA scan, out of these, half will have evidence or may develop renal scarring. So this is the important point to note. And then we say that if DMSA is positive, so 90% of the time there is a chance that there will be VUR, and that's why it warrants that a VCUG should be done. So these are the two approaches, but we will be discussing the guideline and this recommendation for febrile UTI. So we will be comparing the three guidelines. So if you, I think for exam purpose, I haven't seen the importance of Italian Society of Pediatric Nephrology, but here the risk factor are very important that they have mentioned, so I will start it here. So they Italian Society of Pediatric Nephrology, what should I recommend? That yes, they say that you have to do an ultrasound in UTI whenever they present with a febrile UTI, and you have to only do VCUG if there is abnormal ultrasonogram, and if the ultrasound is abnormal or there is certain risk factor which they have delineated, and the risk factor of that they have, if there is an antenatal scan that suggests a urinary tract abnormality, there is family history of reflux, there is septicemia in the child, renal failure, and the child is younger than 6 months, and it is a male infant, and there is a family non-compliance, there is incomplete bladder emptying, and there is no clinical response to appropriate antibiotic therapy, benzoyl and an infection other than E. coli. So this is kind of very important, and they can be remember risk factor and any kind of infections, any kind of febrile UTI, you can keep an eye on these risk factors, and they only recommend late DMSA scan if the ultrasound is abnormal or there is evidence of VUR. While American Academy of Pediatrics say yeah, you have to do an ultrasound, and if the ultrasound is abnormal then you have to do VCUG, and they don't have any recommendation on the MSA scan. While our interest is a nice guidelines, and we will be having that in details, and for that we have to visit in here, and this is the table. Okay, so they have done divide, this is the age, they have classified it into, on the basis of age, into 3 groups, and on the basis of type of infection they have divided it into 3 major groups. So 3 types of infection and 3 types of 3 group of age groups. So okay, so a summary of it is, it's very easy to make a summary for yourself, and okay, so the summary in here is, and let me just make it a bit zoom. Okay, it's zooming. Yeah, so these say, so let's say if you get a child who is less than 6 months, then you have to, what you have to do, then you have to look for thing. If the child responds within 48 hour to intubate, what will you do? If this is a atypical infection, which we have already defined in the first video of this series, or the child may be presented to you with recurrent UTI at the age of 6 months or less. So if he responds within 48 hours, there is no indication to do ultrasound in acute UTI. But if it is typical, yes, you have to do it. Or if it is recurrent infection, then you have to do it. Yes. So ultrasound in acute, no. Yes, yes. The second thing is, if you do an ultrasound, you have to do one ultrasound, either one in acute or within 6 weeks of infection. So the answer is understood. So if you don't do it in 48 hours, you have to do it in 6 week times. Okay, we got it. So this is for ultrasound. What about DMSA? No, not in this case. No DMSA. What about atypical? Yes, you have to do it. What about recurrent UTI? Yes, you have to do it. Okay. So what about MCUG? Ooh, yeah, we will do in this case if the ultrasound is abnormal. If the ultrasound is abnormal, we will do only MCUG in this case. Atypical infection, recurrent infection, you have to do it irrespective of the ultrasound, is it normal or abnormal. So this is here. Okay, what about children 6 months to 3 years? They present to you, you have to do a ultrasound scan during infection. No in this type of infection, no in this type of infection, but you have to do in atypical infection. Okay, we got it. So what about DMSA? Not in this case. So if it is response well within 48 treatment and the child is above 6 months, you do not need to do anything. This is no, a big no. So any child whose age is more than 6 months, present to you with a UTI, respond well within 48 hours of treatment, you have to do nothing. So that's easy to remember. So there exists nothing. Okay, but in atypical infection, what will you do? Yes, I have to do an ultrasound in acute infection. Yes, if he is about 6 months, I will do an ultrasound. Yes, this is yes everywhere. Okay, thank you. What about DMSA? Yes, I have to DMSA in every type of infection. Yes, this is a big yes. But in macerating urethrogram, you will only do in this age category if there are certain risk factors, which is a dilatation in urethrum, poor urinary flow, non-E. infection, or family history of VUR. Okay, thank you. So it's almost done also. Now, what about recurrent infection? If the child is more than 6 months, no, we don't do an ultrasound in the period, but we do it in the later periods, such as up to 6 weeks, and we also do a DMSA scan. Okay, thank you. Do you do an MCUG? Yes, you do an MCUG if these risk factors are present. Okay. What about children older than 3 age of year? What about their if they have a recurrent infection? They are have the same in here, such as they have to go for an ultrasound after 6 weeks, and they have a DMSA scan after 4 to 6 months of the acute infection, and they do not need MCUG. So MCUG is a big no in this age group as per NICE guideline. So I have almost removed those things which you don't remember to, like, if MCUG you don't do it about 3 years of age, DMSA you do an atypical infection every where everywhere you do a DMSA in atypical infection in each group. Yes, okay. You do a DMSA in recurrent infection in every age group. Okay. What about MCUG? You do MCUG and this condition only if the ultrasound is abnormal. An atypical infection under 6 months and recurrent infection you do MCUG all the time. Okay. In this group, you do MCUG only if there are certain risk factor in atypical and recurrent infection. Okay. What about DMSA after MCUG? As I said, no, it's a big no in this age group. So